Cryptococcal endocarditis in the setting of immunosuppression caused by the treatment of multiple myeloma. My name is Dr. Mark Benjamin, and I had the pleasure of working alongside Dr. Arshan Khan, Dr. Jordan Swisher, and Dr. Theodore Schreiber. We all work at Ascension St. John's Hospital in beautiful Detroit, Michigan. Endocarditis can be caused by several different pathogens. While rarely caused by fungal sources, these cases carry a high mortality rate if not identified early on during the clinical course. Often, comorbidities can allow for a more unique pathogen to take hold of cardiac valves and can delay other aspects of patient care. We present the case of a 55-year-old male with a past medical history significant for recurrent falls, chronic back pain, vitamin D deficiency, who presents to the ER with worsening back pain. Upon completion of the imaging and initial workup, the patient was found to have compression fractures of the lumbar region with suspicion for lytic lesions. Further workup identified multiple myeloma. Hematology and oncology were consulted, and chemotherapy was initiated. Neurosurgery was also consulted, but deferred initial intervention until the multiple myeloma was stabilized. The patient became immunocompromised and developed a fever. Septic workup was completed, which revealed cryptococemia as well as cryptococcal meningitis. Given this report, Hem/Onc held further multiple myeloma treatment for stabilization of the meningitis. The patient was refractory to the initial treatment. The patient began developing congestive heart failure symptoms, including fluid retention, as well as an elevated BNP was noted. This led to a TEE, which unveiled a sub-centimeter vegetation on the tricuspid valve. Cardiology was consulted on the patient and was required 6 weeks of IV antifungal treatment. Following the completion of that course, the patient's multiple myeloma treatment could be restarted, and plans to address the initial compression fractures were made by neurosurgery. Significant labs for the patient include a sodium of 128, potassium of 5.3, chloride of 100, bicarbonate of 21, creatinine of 1.39, BUN of 36, glucose of 108, globulin of 4.7, white blood cells of 12.57, hemoglobin of 7.8, hematocrit of 22.4%, pro time of 18.3 seconds, INR of 1.55, and PTT of 39.3 seconds. Endocarditis can be caused by several classic organisms, and only about 1% of reported cases are caused by fungal pathogens, with Candida being by far the most common. Mortality in fungal endocarditis can be as high as 72%, according to some publications. Cryptococcal is an incredibly rare cause of endocarditis, and usually is only found in patients with a history of valve surgery or immunocompromised status, such as in the case described here. Fungal pathogens in the blood can also seed at other locations and cause other disease processes, such as meningitis, again, as we see in this patient. Treatment for fungal endocarditis can include angiovac as a viable option for debulking right-sided vegetations, according to a meta-analysis that was published. However, this method is more effective when greater vegetation burden is present. In this case, the vegetation was undersized for the treatment. Medical treatment is long and includes IV amphotericin B along with flucytosine for a total of 42 days. This can interfere with other aspects of care, such as noted in this case, with it interfering with the continuing of chemotherapy, as well as neurosurgery intervening on the compression fractures of the lumbar region. Our take-home message is that endocarditis has a high mortality rate that can occur at any time in a septic patient, especially when they're immunocompromised. This can lead to interruption of other treatment interventions. Early identification and treatment of fungal endocarditis by recognizing comorbidities such as immunocompromised and patients with previous valve surgery is key to quick identification, treatment, and patient recovery. This often requires a patient-centered and team-oriented approach amongst the primary as well as the subspecialties. Here are my references used for this presentation. Thank you for your time and attention, and I hope you have a wonderful day.